Hello everyone, I am Dr. Shaadab Ahmed, consultant cardiologist at Care Hospitals Malakpet. Today we will be discussing an important topic, that is what is a heart attack. So we commonly hear people saying that someone has got a heart attack, and many people are unaware how to recognize a heart attack. So heart attack is, in simple terms, we mean that the heart is at stress and it has got some disease. So there is some blood supply to the heart for it to function properly. So heart is the most important organ in our body which pumps blood to the entire body. It has to work every second and every minute to pump blood to the entire body. So whenever the blood supply of heart is compromised, it leads to dysfunction of the heart, and this thing is called as heart attack. So this can occur suddenly within few seconds, or the blocks can develop gradually over some few months or few years. However, when we say someone has got a heart attack, it means that the blood supply has been compromised completely. So this always occurs as an emergency. So people commonly suffer from symptoms such as chest pain or difficulty in breathing or giddiness, or they can collapse, or they can have a fainting attack. So chest pain, normally they can feel the chest pain at the center of the chest or on the left side, or it can radiate to the left arm, or it can radiate to the jaw also. And sometimes people who have diabetes or elderly people, they can have just pain in the abdomen, that is in the upper part of their stomach, in the epigastric region. So they commonly tend to misdiagnose it as acidity. So such people, they come to us late with their heart problem, and they have lost some important time of managing the heart attack. So it is always important to recognize the symptoms early and treat the heart attack as early as possible. So apart from these symptoms, some patients can develop gradual blocks in their heart. So whenever they're walking upstairs or they are walking hurriedly, they can develop chest pain, which can resolve when they take rest. So this also comes under heart disease, but it is not a major heart attack. So these patients develop heart blocks over time. So whenever you want to treat a heart attack, it comes under a medical emergency. So whenever the patients, they suffer from these symptoms, they should get to the nearest hospital to get an ECG done. Most of the times, 90% of the times, ECG can diagnose a heart attack. So someone who has a major heart attack, they can be diagnosed on ECG. And also we do a scanning called a 2D echo, which can also help us in diagnosing a heart attack. So when a heart attack is diagnosed, you need to take the treatment as early as possible. So there are some medications which thin the blood and also to control your heart rate, and if the BP is low, to increase the BP. And along with this, we do a test called a coronary angiogram to see the anatomy of the blood vessel supplying the blood to the heart. So whenever a block is seen in the coronary angiogram, it needs to be opened up. So nowadays, with advanced equipment we have, so the coronary angiogram has become a daycare procedure. It is a very minor procedure without any discomfort to the patient. And also, if the block is seen, then it can be opened up safely without any major risk to the patient. The benefits seen with this procedure are unparalleled. So it's very important to diagnose the heart attack as early as possible. Thank you.